All right, the FDA has granted emergency use authorization for a third Pfizer shot for children ages 12 to 15. The CDC would also have to approve the boosters in order for them to become available to the age group. This comes as millions of kids in the U.S. return to schools today for in-person learning, despite those surging COVID-19 case numbers. Last week, the average daily number of new COVID cases topped 300,000. Nearly 500,000 new infections were reported in just one day. Meg Oliver is in Paterson, New Jersey, with more on how schools are proceeding.
Paterson is one of several New Jersey school districts going remote to start the winter. While they are firmly in the minority, some teachers' unions are hoping their districts follow suit, especially in hard-hit cities like New York.
The Omicron outbreak shows no signs of slowing down in New York City. New cases jumped 218% in just 2 weeks. Hospitalizations up 148%. To keep schools open, the city is sending an additional 2 million test kits into schools and doubling the number of students tested each week. But the teachers union is asking for in-person learning to be put on pause. And teachers like Camille Eterno are urging the mayor to listen.
I recognize the need for students to be present in the buildings, but I'm also cognizant of the fact that if we're all bunched up together and we get sick, we're not going to be there anyway.
Only about 100 of the nation's over 13,000 school districts are opting for virtual learning this winter, despite surging case numbers. In Washington, D.C., the number of new cases jumped 331% over the last 2 weeks, and city officials extended winter break by just 2 days so all students had time to get tested. About 1 in 4 tests are coming back positive in Miami-Dade County, where schools are also opening on time.
I believe even with Omicron, our default should be in-person learning for all students across the country.
On Face the Nation Sunday, Education Secretary Miguel Cardona told CBS News' Margaret Brennan that the Biden administration is helping school districts secure more tests to keep classrooms open.
I still believe very firmly and very passionately, not only as an educator but as a parent, that our students belong in the classroom and we can do it safely.
The secretary says that includes mitigation strategies like wearing face masks, vaccines for kids who are eligible, and social distancing. On Sunday, Dr. Anthony Fauci said the CDC received some pushback for their new COVID isolation guidelines. It does not require a negative test to exit that 5-day period. Dr. Fauci says they may reconsider requiring it. Vlad, Anne-Marie.
Meg, thank you very much. Let's talk about that with Dr. Rajeev Fernando. He specializes in global infectious diseases. He's also a fellow in disaster medicine at Harvard Medical School, and he joins us now to talk about this. So, Doctor, you heard the conversation that Anne-Marie and I were having about students. In cities like New York, for example, they have ramped up on rapid testing for students as schools reopen, but some researchers continue to question the reliability of the rapid tests. Is this the best route, or should school districts reassess?
Good morning, Vlad. Good morning, Anne-Marie. Thank you so much for having me in the show. Now, there were some concerns last week about these testing, the antigen testing not being so good, but I politely and respectfully disagree with that. I think the antigen tests are a great way, they're great options. There shouldn't be a reason, because whether you're testing for the Omicron variant or the Delta variant, the antigen test just detects the antigen. So I have fairly good faith in the antigen test. Remember, if someone has symptoms and your antigen test is negative, that's when you should go the distance to get a PCR test. That's the gold standard.
That's good to know. Sunday, on Face the Nation, former FDA Commissioner Scott Gottlieb said that the Omicron variant appears to be a milder strain of COVID-19, but the danger still remains for children. I want to play a little of what he had to say about that.
We have to recognize this has not been a benign disease in young children. There's a perception that young children haven't been hit hard to date from coronavirus. That's just not true. We've recorded more than 600 pediatric deaths from COVID over the last 2 years. To put that in perspective, we had 1 death from flu in the pediatric population last year, and so far 2 this year. So over a period of time, we've done a very good job protecting children generally from respiratory infections. We've recorded more than 600 deaths from COVID against 3 deaths from flu. So this is affecting children, and particularly young children. This new strain could have a predilection, again, for the upper airway, which could be a bigger challenge in young kids because of the way that it binds to the airway cells.
So you heard a little bit of what Dr. Gottlieb had to say, you know, and he basically said kind of the Delta variant, the one that we've seen sicken so many people, was more damaging to the lungs than the Omicron variant. But that could be bad news for kids. What's your take on this?
Yeah, full respect to Dr. Gottlieb. But for me, it's important to understand that you can't really compare the flu to COVID-19. Now, the flu largely infects only the lungs, only the respiratory tract. But we do know that COVID-19 is a multi-system involvement. It affects the heart, the lungs, the GI tract, CNS. It's a multi-system involvement. And of course, COVID-19 is a winter virus. This is a time where winter viruses surge in children. So it's not unreasonable to think. Remember, the sheer numbers are actually driving hospitalizations. I haven't seen any increase in ICU cases. So that's very important to know. They still remain very mild. Very, very important to watch these cases. But also, we do have vaccines. So all the cases are vaccine preventable. The cases that I'm seeing in kids tend to be immune compromised kids, and African American kids tend to have a higher rate of infections at the hospital. And this really parallels what we have in adults. We do know immune compromised adults, African Americans and Hispanics are at higher risk for going to the ICU. So I advise all the experts to watch this very closely, but certainly not a time for alarm at this point with regards to kids. Get vaccinated.
As you know, the CDC reduced its quarantine guidance for people who test positive for COVID from 10 to 5 days. And we're talking about people who are asymptomatic. But now Dr. Anthony Fauci says that, you know, maybe the CDC might be considering requiring a negative test first before you can stop isolating. You know, I'm wondering if you were one of those people that thought, yeah, why didn't you say that to begin with? Or what's your take on this?
Yeah, it's unfortunate. I think this is the right recommendation. Unfortunately, many people across the country, many experts as well, felt with the initial recommendations for isolation, we felt that, economy was coming first before public health. And many of us were uncomfortable about that. But I'm really happy the CDC is going to take another step and look into this. Public safety is so important right now, especially in a virus that's surging and surging. And we just still learning about this virus. So this is actually a much more reassuring approach for me that ending the isolation with a rapid test is the right approach for America right now.
You know, I just want to jump in a little bit, Doctor, that the other thing about testing is that it offers you a confirmation that you indeed do have the virus, because I think that because there are many people who have either mild or no symptoms, it's almost hard to believe that you're carrying the virus. I think people need that visual confirmation. Just in, you know, talking to some of my own relatives who tested positive, 2 of them tested positive when they didn't have any symptoms at all. So they really questioned whether the test was valid or not. And so I think that we run the risk of people getting up on day 4 or 5 saying, I feel great, I don't need a test. And sort of walking out of their house and reinfecting people if they are not required to confirm that they're no longer sick.
Yeah, it's a great point. And, you know, there still is a lot of controversy with testing. And I really think, you know, the best way to use a test is, of course, for public health information, is to know when someone tests positive, are you vaccinated or are you unvaccinated? Are you symptomatic or not? And there still is not clear-cut guidance from the CDC on that. And that, for me, that actually takes the weightage of how important these rapid tests are, especially for screening asymptomatic patients. For me, looking ahead in the country, I really think we should focus on hospitalizations and deaths. That is the single most important tool. Also, Anne-Marie, it's important. A lot of people are not reporting these tests. They do these tests at home. They come up with the positive results. And how many of them actually report it to work? Many people don't want to tell their job. They want to continue working. So for me, the accuracy of these numbers is really questionable. So that's why I put in more weight into hospitalizations and deaths.
Oh, that's really interesting, Doctor. Dr. Rajeev Fernando, thank you so much.
Get safe and stay boosted, America. Thank you.